Hi guys, I'm making this video as many people have asked me about what the ADC's email was all about for explaining the revised competencies. So I went to their website and I've opened it out here to the competency section. And yeah, so I'll just go through them briefly to understand as to what they mean by it. So basically, yeah, this is their revised thing. They are going to judge you, and I think this is mostly for part 2, but of course in part 1 also it's going to reflect in your questions. It's focused more on your thinking and analytic abilities. See, the reason why they have released this now and have explicitly made an entire document explaining this is because earlier, like before September 2021, what used to happen was they used to just ask the basic MCQs, okay, and the part one exam. So it wasn't much of thinking. It was just question and there is an answer. And it's an MCQ question. For example, like what do you use for irrigation in root canal? The answer is sodium hypochlorite, like that. But then they changed their pattern and they divided into clusters and they gave scenarios. And in scenarios, you're asked to think. So now what they have done is after releasing that pattern of exam, they are just basically telling you that we'll be judging the way you answer your question. What is the way you answer your question is how do you come to a particular answer? Like, what parameters are you considering while coming to the answer? Because the answer is a dental, of course, subject, but there's a way you derive that answer, and that is checking your competencies. So that is basically revising the competencies for the exam because earlier they were just judging you on that basic MCQ answer. Now they are going to judge on the ability as to how you arrive to a particular answer. So in the part one, it's basically written. So they'll give you scenarios and they'll give you scenarios which will cover topics, with all these things. So for example, if I have to give you on social responsibility and professionalism or health promotion or person-centered care, for example, if they give you a question saying that a patient is having irreversible pulpitis in a tooth and the tooth looks very nice and root is good, so scenario one, the patient comes to you in the city. What would be your treatment plan if you want to save the tooth, or what would be your treatment plan to manage the patient and the tooth, basically, not save the tooth? So you can consider the option of root canal because your clinic is in the city and the patient can come there and you can give him that option and you can finish the treatment. But if the same tooth is given, you see the tooth remains the same, the pain remains the same. But now the patient is coming to you from a rural area, which is like 400 kilometers away, and the poor guy has to take, bus, train, and walk a lot to reach to your place. Now, what would you do? So, as a, you know, person having empathy towards the condition of the patient, basically a person-centered care, you would probably not think of doing a root canal because that would mean for the same tooth the patient has to travel so much and you instead can choose to extract the tooth and give a replacement, which would save a lot of time and pain and everything to the patient. You understand? So now your answer will differ, correct? And it can be asked in your OSCEs as well. So previous scenarios, like not even a scenario, like before 2021, if the question would have asked the patient is having irreversible pulpitis, what would be your answer? Pulpectomy, extraction, whatever, and the patient can afford to save the tooth, pay for the tooth basically. So you could have chosen directly pulpectomy, right? But here now the scenario has come, they are giving you to judge on how much you empathize. Do you consider the patient's welfare also and not just your treatment plan? You understand? It becomes more of a person-centered care. So that's my example of a person-centered care, and that is what I could understand by reading all these things which they have given. So I'll go one by one. So that is what competency is all about. It's the way you think, and I'm really glad this is a very good structure. You know, like I really praise this about the ADC exam that it's no longer memorize and just click on the answer. They're actually checking whether you're a good clinician. See, you are a trained dentist. Nobody's doubting that. But are you a good clinician that respects a person's, a patient's overall well-being, that takes into consideration the other factors which are affecting the patient? About that, see, I'll give you a simple example. Now, if I come to critical thinking, which they have mentioned here, the process of assimilating and analyzing information and encompassing and interest in finding new solutions. Critical thinking means you are finding new views. A professional curiosity with an ability to admit to any lack of understanding, a willingness to examine beliefs, biases, and assumptions, and to search for evidence that supports the acceptance, rejection, or suspension of those beliefs. See, when I'm going to read this, it may sound boring to you, but I'll give you an example which just happened today. And I was just reading this entire document. And when this thing happened with my own patient, I was like, this is a perfect example that I can give you to understand. So, critical thinking, okay? Now, critical thinking is what? Is you taking an active interest and trying to find the way to treat while debunking or accepting the patient's belief and helping them. So I'll give you an example and we'll take out the points from this. Okay. So this patient came to me today. Okay. Her name was Anavia Sheikh. And she was a 6 year old. And in the morning, the mother had called me and she was like, my daughter is having a lot of pain. Can we get her to you? We had visited another dentist and we said we have to do a root canal. So on the phone itself, I'd asked them, do you have any x-ray? She said, no, I don't have an x-ray. The doctor just mentioned that we have to do a root canal. So I said, no, we have to do the investigation properly, then only we can see. She was like, fine enough, doctor. That's what even I was wondering. How could the dentist say that it's going to go for root canal without an x-ray? So we would like to come to you for another opinion and get the treatment done. I was like, fair enough, come over. So when this patient came, the 6 year old child, I asked her to sit on the dental chair, and she was accompanied by her mother and her mother's sister as well. Okay. Now they sat and they started explaining that the child was having immense pain at night, and I asked the child, where she was having pain, and she was pointing in this area. So of course they are broken down into pieces, but there is also caries here. So the first thing I did was take an X-ray, and I could find, see this is my X-ray. These two are of course grossly broken, and there was a nice cavity happening here. So now I told them my treatment plan that we'll have to extract these two root pieces, and this looks like a very deep cavity, but I don't think so. It's in the nerve because the history of the pain is not correlating. Also, on and off sensitivity is there, but not major pain or any swelling. So we'll do a deep filling basically, and in future we'll see if it goes for an RCT. So here my critical thinking point comes. Okay, so when I explain this, the mother says, "Doctor, I don't know if he's going to able to be able to cope up with it, and I'm actually hesitant. Like, is there any other procedure that we can do to relieve her of the pain?" So I told her, I understand your anxiety about the patient being not able to cope up, but we have a way of dealing with children and we'll do that. But as for any other solution to relieve her pain, you have already given her painkillers and you told me that she still has pain. So of course the painkillers are not working and this is an active infection going on. You have no other option but to extract these two teeth. As for this permanent tooth, you can either get a filling done, you can either remove the tooth, or you can leave it as it is, but the pain can continue and it might go for root canal in future. So at this point, even me, even after me explaining this twice or thrice in different ways that this is the only treatment that we've done, the mother was still hesitant. Okay, and when I had taken the intraoral pictures for this patient, I had seen on this area that the teeth were extracted, and she's just a 6 year old child. So I asked the mother that already she had extractions done. So what is your hesitation about? Okay. Now here I'm trying to use my critical thinking to understand why the mother is being so hesitant. So the mother said, yeah, the teeth were extracted back in the home country and she was absolutely fine with it. So she has undergone the process of extraction. So I started to think then what is the problem? So I asked her, were you there with her when the extraction was done? So now the mother says, no, I wasn't there with her, but my sister was there with her. And the whole time the sister was sitting next to me, okay, and she's collaborating with the story. So then I told the mother that, were you ever there with her when her dental treatment was being done? So the mother says, no, I was never there because I was working elsewhere at that point of time. So now I understood the point that the mother was never there with the child when the treatment was done. So probably she doesn't know how it feels to get the treatment done. She's never seen her child getting a treatment done. And that's why she's being hesitant as to what may happen. And out of her feelings for the child, probably she's the one who's not able to cope up with the treatment. You understand? Here my critical thinking came up. So I told this exactly to the mother. Are you afraid of the dental treatment? And bang on, she said, yes, doctor, actually, I'm afraid of the treatment as to what will happen to my child. So here, instead of, just keeping on focusing as to, look, this is the treatment is done, and if you don't this will happen and that will happen. I tried to reason out with the patient. I tried to find what was the exact problem. Because when you treat a child, you're not only treating a child, you have to take the parents into confidence also. So here is an example of my critical thinking where I was trying to figure out what was the hesitation about, because it wasn't coming directly from the mother, because even she was not knowing why was she in hesitation. But the moment I outlined these steps, which was basically finding a new solution to this problem that we were having of hesitation, the mother just came on board and she was like, doctor, I think I'm the one who's having anxiety. So my sister is here, and at that point, the sister said, "I have got this procedure done before. I'll be there with the child." The mother said, "I'll be outside," and I was like, "Fair enough." And we proceeded and got the treatment done very nicely. So you see, here you have to find a way to be very respectful towards the mother, understand what the problem was, and respect her wishes, explain her the entire solution, and then we could get the treatment done. So this is basically critical thinking. So critical thinking can come in various scenarios in any subject, endo, pedo, perio. They will give you a scenario and then you have to think what can be done. So at this point of time, if we keep on focusing, no, I will just speak about the teeth and this is my patient and I'm just going to do the work. I will not care about the feeling of the parents. That's not going to work. You need to have that professionalism and person centered care and critical thinking. And you need to communicate it. You have to think like a leader. Like, how can I find a solution to this instead of just saying, no, this is what it is? So, these factors which they have given, they have not given you examples, because how would they give you examples? Every scenario is different. But this is my example of critical thinking, which exactly now fits this thing. So if we read this paragraph again, you see, I took an interest in finding a new solution. I had a professional curiosity as to why is the mother being so hesitant, a willingness to examine the belief, like what was her belief, her biases, her assumptions as to what would happen, and is there any evidence that supports this, and ability to distinguish between the fact and opinion. So I could distinguish that the fact was that the treatment, the daughter had it and she was fine with it. It was the opinion of the mother that maybe she won't be able to cope up with the treatment. Ultimately, she understanding it was the mother that she could not cope up. The daughter can cope up with the treatment. So you have to dig down. Basically, you are an examiner slash clinician slash investigator. Like you have to go to the bottom of the problem. It's very interesting. Every patient is a new book. You will never find two patients the same, even though they may have the same dental problem. So this is what critical thinking is about. Now, cultural safety for Aboriginal and Torres Strait Islander people. Well, I am not from Australia. I don't know how they behave, but they are human beings. So, whatever this is written, I think we generally follow it for every patient. nothing exceptional about them. Apart from that, that they are prone to more rheumatic fever and indigenous people are having more heart diseases, something like that. That's why you have to give them antibiotic prophylaxis. So remember that. Evidence-based dentistry, well, we all read articles and etc. Financial consent, yeah, of course. So, financial consent, I'm sure when you were reading your part one, there were questions in which the options were once the patient understands the financial thing, then he would make the decision. So you're practicing and there is a payment for every service. After you have explained everything, you also need to tell them the cost of it. You cannot just explain them the procedure and start with it, and after finishing the procedure, you're telling them, oh, this is going to cost this much. I know it becomes very awkward as a practitioner when you're sitting and you're explaining everything which is scientific, and suddenly you start talking about money, which becomes very commercial because healthcare is priceless, honestly. There is no price to relieve somebody of the pain, but of course we have all put a price. We all need to earn. We all need to survive. So when it comes to money, it looks more like a commercial thing and more business thing. But then the money part has to be informed to the parents, and you have to do it in a very soft, respectful way. And if the patient says they are not able to afford that, then you need to give them good options. Like go to a community health service, go to a government service, or some discounted places with full respect. Like you should not be talking to them as if you're mocking them for not having that much money for which the treatment is indicated for. So you need to show that professionalism and empathy while telling them it's all right. You can think about it. You can get back to us whenever you have made up your mind, and this is how we can help you. And with all genuine humbleness and humility, you can tell them that we can refer you to a place which can be more helpful to you than us. So this is your ability to acknowledge the patient's financial condition. Now, coming to groups of population at increased risk or harm or poor health, they have themselves given the criteria. Malnourished, low income, sensory or disability, autistic people, those people living in regional and remote areas, marginal people, cultural and linguistic diverse background. They have themselves given this. So if your question mentions that the patient is a socially disadvantaged patient, then you have to look at the scenario from that point of view also. Okay. Now, health promotion is fine, nothing much. Informed consent, yes. Like I mentioned, you need to take the consent about all the procedures and finances involved. Interprofessional collaborative practice. You need to be again very professional when you are communicating with the patients, families, carers, communities to deliver the highest quality of care across settings, which you are already doing. So they have just put into words. There is nothing more to add on. Leadership is, for example, a patient comes to you and says that he's been smoking, and this will come in your part two exam. You'll have OSCEs in which the patient says he's been smoking for so and so years. Now you have to be a leader in that, and you have to promote the health of the patient also. So you cannot humiliate them by saying, why are you smoking? It's going to affect your health. No, you have to say them, have you ever thought about quitting it? Is there any help that we can do from our side which can help you in quitting it? Because quitting will help you to improve your oral health and general health, and your health is important to everybody around you. So this is how a leader will speak. He will give them idea because sometimes people will not be aware that okay, smoking is causing us problems because maybe they have people in their family who have been smoking for years and have no problems at all. So they might be like, probably it's not a bad thing. People are doing in my family. Why shouldn't I do it? It relaxes me. It relieves me of stress. So here your leadership quality will come and you will inform them. You will take an initiative. Initiative taking is a quality of leadership. So this comes in your part two exam. But also in your part one exam, if there is an option that you can give an advice to the patient and do your treatment, then I would choose that answer. Are you understanding all these points? Am I going too fast for you all? If I am, just pause the video and go through the particular topic that I've spoken about. There's a lot to speak about because there is a lot written also on the board, right? So coming to manage, what is manage? Manage the oral health care needs of a patient includes all actions performed by practitioners within their abilities, competence, and experience that are designed to alter the course of the patient's condition. So manage means basically you got a patient, you are doing everything in your ability to ask them the right questions, provide them the correct education about an issue, advise them, diagnose the problem, and treat it. And if you cannot treat a patient because it's beyond your limitations, for example, a complicated third molar extraction, then you should acknowledge that and then you have to refer it to the another practitioner. And managements also include, this is a very good line, it includes observation or providing no treatment. Let's just manage. For example, a patient comes with an ulcer and you tell him, okay, you know what, just have symptomatic relief and we'll wait and watch how it progresses. Or there is just, a geographic tongue and you tell the patient that this is what happens and we'll wait and watch as to if it grows into something else. So your treatment is just observing, but you are still managing the concerns of the patient. Okay. The main important criteria is whenever a patient is coming to you, is coming with a concern. You have to manage that concern. See, in your part two, na, when you'll have the communication OSCEs, the last line of the question will always be manage the patient concerns and provide diagnosis or provide the treatment plan or gather more information. But this word will always be written manage the patient's concerns. So, what is the patient's concern? Whatever he will say, I have pain, I have certain patch on my tongue, cheek, whatever, whatever. So you need to understand managing means you need to find the full history, geography of that lesion and then accordingly provide the right kind of treatment, which also includes referring to a practitioner and then following with the patient whether he's got the treatment done or not. Once because he's your patient, so he's going to come back to you once he's been to the specialist. So you are his primary caregiver. So patient, what's patient, right? Person-centered care, I just spoke about it. Right? It involves seeking out and understanding what is important to the individual receiving care, fostering trust, establishing mutual respect, and working together to share decisions and plan care. This is what I just gave an example about. Key dimensions of person-centered care includes respect. Respect is a paramount of any profession. Dignity, emotional support, physical comfort, open and honest communication, continuity and transition, care coordination, involvement of carers, family and community, and access to culturally safe care. Person centered care is basically your warmthness, your nature of caring towards the patient. You are not emotionally involved, but you can empathize with the patient. Like if a patient says, Doctor, I have such a stressful day at work and now the school is giving me a problem. Don't just directly jump on to say, oh, let's examine your teeth. See, this is your part two exam, okay? You can start by saying, oh, I'm so sorry to hear that you had a very difficult day. Would you like to talk more about it? Is anything, you would like to say which makes you feel better? You can always jump onto your teeth issue later on. See, another example I can give today is I had this patient. Okay, I go to her picture. Now, when the father came, the chief complaint was that my daughter is clenching her teeth, and again, she's a 6-year-old child, and her teeth are all getting flattened out. One look at the teeth, and I knew this is dentinogenesis imperfecta. Look at the condition of the teeth. You see, it's all upgraded. It's not carious. You can actually see the dentine and the translucency of the teeth, even the permanent teeth which are coming out. I've seen so far 6 to 10 cases of dentinogenesis imperfecta, but I know when I see one. So my first question was to the father, do you have similar teeth? And he said, yes. Then I asked, anybody else in your family have similar teeth? He said, yes, my brother. So I asked him, how are your teeth doing now? He said, doctor, I'm 42-year-old, but I got all my teeth capped at the age of 32 because they all crumbled away. And I wasn't eating sweets and there was no caries, but my doctor said your teeth are crumbling away. So then he started talking about himself. Now, see, the daughter is my patient and I have limited time, but you have to be professional. So I made him sit down and then I was just talking to him about his sleep for quite a while, though he's not my patient and I'm not going to treat him for anything. So then we spoke at length as to how, he went to the dentist and right now also he's having a problem and he's so fed up with his teeth. So I was just there, with him to give him support. And at the end of it, I made him realize that I understand, that you're very fed up because you have so many caps and you still have one or few teeth left to be capped, but they are crumbling and giving you a problem. We are there to help you as much as we can. And then, of course, he was also a little distraught on hearing because when he took OBG of the daughter, she was also having a similar condition in the permanent teeth as well. That the daughter was also going to go through the same thing. So I was very patient with her. I told my reception to tell my next patient that I'll delay them by 10-15 minutes because here, though we are not doing any treatment right away, but this is news to the father and he finally realized what he's having and it wasn't his fault. So, you see, I was giving him empathy and I was concerned that he feels all comfortable. And at the end of it, we spoke at a length and he completely understood the situation. And I told him it's not his fault, it's not his daughter's fault, it's genetics. Sometimes genetics does play a role because when you find out that you have a condition and that is destroying many things in your mouth and you have no role to play with it, you want to have a closure as to why this is happening to me. Why other people don't have it and why I only have it. You understand? So you need to have that emotional support with respect and dignity and open and honest communication that this is what it is and it's nobody's fault and but we can do something about it. Because the father went to an extent of because he was fed up going again and again to the dentist that some of his molars crumbled to an extent that they had to be removed and he got an implant done. So I told him because we'll be seeing his daughter like frequently from now on just to make sure she is fine. We'll try our best to make sure that she doesn't end up with implants or something. So that I mean, in between only we'll start taking proper care, give her proper crowns at the right ages. So he was feeling a lot better after that. So this is what a person-centered care. This all things which is written here. I'm giving you the example of today itself. I'm sure you must be doing 90% of the things which are written here already in your practice. But these are just the words which have given the meaning to the long discussions that you have with your patients. And for a new practitioner who's starting, this is a very nice guideline for you to follow. Like when you read this and when you listen to all the examples that I've given you, you'll understand how to approach any case and not necessarily you'll be treating the patient for what he came for. Like for this daughter, I examined, and the patient was the daughter, but like I said, I ended up empathizing more with the father because he got into his own stories, and which was necessary for him to let it out because with whom he's going to talk to about his teeth? It's the dentist. So there you become his caregiver. So, a long consultation, but a very fruitful consultation. Understand? So, that is the person centered care where I was also bothered about him and the daughter and not just jumping onto the tooth. Let's start the capping right now since we have come for the treatment today. The daughter did not have pain, so we can, of course, have another appointment for it. And my focus was just making them comfortable. So, this is how this sentence means a person centered care. Now, self reflexive. It's the ability of a person to reflect on one's own actions while consciously taking a proactive approach to self-improvement, collaboration, and lifelong learning. Self-reflex is basically you being yourself, you're looking at yourself from a third person's perspective. Whatever you're doing and whatever you're talking to the patient, you are analyzing it in your own head. Am I doing the right thing? Can I improve more upon it? You're not being stubborn. See, I'll give you an example. I remember once I had just clinically examined, the tooth looked very, very closely. I was in a hurry, and the patient was also in a hurry, and they just got one of the siblings who was not my patient, and they were just like, "Doctor, can you just see his tooth while on your way out? We'll also book an appointment for his next visit if you find something." So I just asked the child to open the mouth, and I saw very curious teeth. And I was like, probably they'll go for a root canal the way they are looking, but I'll take an X-ray and then I'll confirm with it. Okay, and I left. So they booked an appointment for the child, and when the child actually came for a consultation, I took an X-ray and I found that they did look a lot deep, but probably I could just save them for a filling. Now the patient just remembered my words that I said I'll do a root canal, but I did also mention that I'll be doing an RT. So the patient was like, "But doctor, you said a root canal. So what if we don't do a root canal and my child ends up with pain?" Now, I as a practitioner, the patient's care is forefront. So I had absolutely no difficulty in telling the patient that I did not take an X-ray, but looking at the grossness of the tooth, I had thought, but I was wrong. And the X-rays clearly show that though it's a very closely placed tooth, but it's not involving the nerve, and we can just clean and do a filling and probably put a crown on it because it's a white cavity. But it's definitely not going in the nerve. So the patient was like, "Doctor, are you sure?" So I'm like, "Yes, I am. And in case it goes in future, then I'm always here to do a root canal." So basically, as a practitioner, if you sometimes take a decision and later on want to change your decision, it's okay because you are doing it for the benefit of the patient. Here, your ego, your image should not come in between. That's a self learning that in case you thought of something and then you're changing your decision and you're informing the patient about it, there is you would become small in making your own decision corrected. You understand? That is called as a self-reflexive. Uh, you don't have to show that whatever you had said once is the hardcore line and that only needs to be done. You can always change and you can tell the patient that I took a change in my decision because I feel this is the better for you right now. The patient would understand and would in fact respect you. And my patient was very happy. Wow, this is no longer going for root canal. Though that was not my criteria. If it was going for root canal, I would have done it. But it's generally not going. So it's not going. You should look at yourself from a third person's point of view. Like you judge yourself also and see what can you improve in your practice. So yeah, I already spoke about social responsibility and professionalism. Social responsibility is they have given a lot of things. When you read, I wish they would have given examples, but they didn't. So only reading becomes a lot boring. But pretty much it encompasses whatever I've told you how to handle a patient. So here they have given newly qualified dental practitioners must be able to engage respectfully, blah blah blah, gather information, have an interprofessional collaborative practice, person-centered care. Okay, now this fourth point, okay, I'm sure questions are going to come on this one. Recognize, assess, and respond to domestic and family violence. Risk. Prioritize safety, provide information, and refer as required. All right. Now coming to this, I don't know what kind of questions they'll be asking, but I'm sure there'll be scenarios where you would be forced to think, is this really because of a dental issue or something else is going on? I remember in part one there were questions like a child came to you, it was a very summer hot day, but the child was wearing full sleeves and she came with her mother or somebody else and there were already six siblings and it seemed that the front tooth was fractured because of a fall and the child was very shy and timid and overall vibe was not a good one basically. So you wanted to check if the child was of domestic abuse. So in that scenario, the question was, whom should you call? Should you call the child SE? No, you should call the child's general practitioner. And the answer was, you should call the child's general practitioner. So apparently questions are going to come on that. So if you see a child and looking at all this, you'll be responsible to call the general practitioner and inform them about it and then the general practitioner can take over. But in case of adults, I don't know how the question will be framed, but expect a question on this. I think even in OSCE's part 2, I won't be having this pattern in my exam because this is going to be implemented from June onwards. So only when the candidates appear and somebody has this kind of scenario, if they come out with it, they'll tell us. My exam is next month, and this is not going to be implemented for my OSCEs. My OSCE is still going to be on the old pattern. So I won't have a first-hand experience of it to explain you. But if anybody gets this kind in from June onwards, feel free to describe the scenario in the comment section so that everybody knows and you can be helpful. See, social responsibility come into it. I also feel, see, I'm shooting this video. I have understood what all is written here, but many people have not because maybe they have not encountered such scenarios or analyzed the way I'm bringing it out to you right now. This is my social responsibility. You see, as a practitioner, I want to help because that should be the way. You should help your colleagues. Even I reached here where I am because somewhere some people have genuinely helped me. Yes, a lot of people are jealous and have tried to put me down, but there are people who have genuinely helped me, not because they have some inclination or likeness to me, but because they saw that you should help for the benefit of the society. And that is what I'm trying to do. In general, I feel in medical professions and dentists, like till you are in graduation college, we are all friends, okay? But once you pass out, and especially in the postgraduate, you no longer have friends. You're just colleagues, and there is this professional rivalry. God knows for what. I understand survival is difficult, and in certain parts of the world, especially in my own country, India, the dentist is present in every hook and corner of the street, and the cost is so less that it really becomes difficult to run your own practice. You don't want to let the patient go away. So sometimes, health professionals start berating your own colleague or berating the dentist. Oh, that dentist is bad and he doesn't have a good work and you get a good work. That should not be done. In all this bitterness, the essence of the knowledge is lost. Like if, suppose example, somebody else is good with the root canal and he has certain tips and tricks, why wouldn't you want to share it with the world? You should not feel that if I share my techniques, my patients will go. No, no. You alone cannot treat all the patients in the world, first of all. The reason you can practice is because there are great authors and people who have written down those tips and tricks because of which you read and you could incorporate it in your own practice. Share it with the world. Spread the good vibe. Do what others are doing in a good way. You don't have to become selfish and limit everything to yourself. If you start limiting things to yourself, even you wouldn't learn, you know. So I, I'm doing all this for ADCs just to help because I saw there was so much of secrecy and restriction of information that people were just forced, paying hefty prices to get just the information. See, nobody's telling you not to make a business out of it, okay? If you are good at something you want to teach, go ahead. But there are a lot of information which you can still share. And there is nothing wrong with that. You're helping, and you were also helped at some point by some people without charging you money. The world doesn't have to become such a selfish place. So this is what a social responsibility also means. When you give an information to the patient about other areas of his life, when you find there is a problem, you are not diminishing anything from yourself. You are just helping that person. You understand? And somebody might help you too. So this is what a social responsibility means. I'm not trying to make this as a lecture, but just speaking about this competencies is they are basically trying to tell you all these things. Now engage in a mentor-mentee activities and leadership within a healthcare system. Yeah, this is what I just spoke about. Like if you're working in a team and you feel something of your initiative can help the team, go ahead and do it. You just don't have to think, okay, I'm just doing a job here. Why should I, take an initiative and do something else? I'm not getting paid for it. No, that should not be the case. Maintain one's own health and well-being and support the health and well-being of colleagues and team members. Yeah, why not? Utilize digital technologies and informatics to manage health information and inform person-centered care. Yeah, use technologies. Half of the time my Google is open here. Like I use the technology of Google to show so many images and videos to the patient, and I take an active this thing interest even in the patient's parents. You know, if they say, "Doctor, even I am having a tooth, is having a problem," though my patient is their child, I will ask them, "Can I have a look?" And if I see something which I can explain, I will sit down and explain. I won't just say, "You know what? You are an adult, and I don't treat adult patients. Why don't you go to the colleague who's next door?" No, I will sit there. I will explain them the entire scenario of what will happen when they go to the other dentist and what all things that person will do and why it's important to get it treated, you know. I sit and I devote my time explaining them, even though they are not my patients and even though I'm not going to get paid for that time, it's okay. You know, everything doesn't have to be money centered. This information spreading is you taking a leadership, you being socially responsible so that the patient takes care of their own health, because half of the time they don't do anything because they are not aware that that is happening. All you have to do is just make them aware, you know. Identify opportunities for improvement in care delivery and advocate for improved oral health outcomes. I mean, this is all what we are doing. Critical thinking. I already covered this in great detail in my first example that I gave. So that is what it is. Then we have health promotion, scientific and clinical knowledge, and person-centered care. Health promotion is this is for the dentist. You can read this through. This is very easy, scientific and clinical knowledge. You know, you read, you come across new articles, you apply the principles of risk management and quality improvement. Like basically you analyze, you don't just treat. This is very important in your part to ask you also. So, example is again a parent comes and I see a completely destroyed set of teeth. I'll show you one of the patient's teeth. You'll understand what I'm saying. The patient was not having pain on that particular day when they came to me. Yeah, this patient. Look at his teeth, man. Lower right quadrant, completely destroyed. The front ones. Like if you see all the pictures, all 20 of his teeth is a 5-year-old child, completely destroyed, and there are even abscesses present out here. And I mean, this is like total negligence because the child was having constant sweets, only child, and the parent were like, they are melty, doctor, they will fall off, then why should you worry about it? So I'm like, then what made you come here? So they were like, the child is having, you know, swellings on the top two teeth and on and off pain here and there, but today he's not having any pain. So I explained them about the teeth condition, took all the radiographs, etc. Now, my treatment does not end here. So, you have to manage the patient, and I have to give them this scientific and clinical knowledge. So, I have to apply this point. What is this point? I asked them, why did this happen? Then they went on to say, we did not brush, the child does not allow us to brush, and he's eating a lot of sweets, and blah, blah, blah. So then now the counseling started. See, this is basically me counseling the parents that you should not give sweets and diet modification, etc. etc. Because I can treat the patient, but the management will come from both of us. So this is applying the principles of everything what they have mentioned. All right. And then finally treating the patient and then having follow-ups to make sure that the risk of caries is mitigated by them doing everything that what I'm telling them. See, when you tell a patient 10 things to follow, they'll follow 4 things. They'll forget the rest of the 6 things. It's impossible for any human being to incorporate so many new things in life, you know, when they have a set routine. So when you follow up slowly, slowly, you keep on pushing them. Okay, add these 2 things first. So you have to keep on repeating the same things, but then it's called as motivation and it's called as quality improvement. You understand? So this is what this means, and this was the best example I could give you. Person-centered care, like I said, obtain a relevant history and maintain very good records. Take radiographs relevant to the dental practice, etc. So this is also person-centered care. Like you're doing a thorough investigation, diagnosis, treatment planning, etc. So I hope this is all clear. It's not difficult. Already these things are incorporated in part one and part two. Okay, they have just kind of written it down. manage skeletal and dental occlusal discrepancies. This is what you do when you examine. Basically, what they are saying is to examine everything about the patient's mental, physical, dental, and financial aspect, and then make your decision to go ahead and make sure that the patient is comfortable. It's a very good guideline, guys. It's just it becomes a little boring to read, but I hope with the examples that I could give you, you are able to understand what this is about. And when you'll be incorporating this in your own practice, you will understand that whatever they have written, you are seamlessly doing it anyways. But of course, reading this would help. So my suggestion is don't read everything together. It will get too much. Just take a one topic and read. And if you have any problems in understanding, just leave me a comment. And I'd be more than happy to help you understand it in the way of examples that I've given you. So I hope this helps. Let me know how it was, okay?